Hi, I'm Arthur Kevin Castor. I'm the Program Manager for Nursing Quality, and I will be discussing emergency preparedness. Here's the outline of my lecture. Today, I will be discussing the EP structure, the different emergency codes, and how to respond to common emergencies and disasters, such as fire, earthquake, power outage, and bomb threats.
The goal of MMC's Emergency Preparedness Program is to equip all employees on how to respond and recover from internal and external emergencies that affect hospital staff, patients, visitors, and the community. This program provides a coordinated and organized response to incidents that, without proper planning, may overwhelm the capabilities of the hospital and community healthcare system.
Emergency preparedness is a critical aspect for every medical and other allied health professionals. The right emergency response strategy can prevent or mitigate casualties in a lot of ways. The Emergency Preparedness Committee develops, maintains, reviews, and updates an emergency management plan to respond to likely community emergencies, epidemics, and natural or other disasters. The function of the Emergency Preparedness Committee or the EP Committee is to create policies and procedures, allot budget for training education of staff, procure safety equipment, and to routinely evaluate the emergency program of the hospital.
Another function of the EP committee is to conduct risk assessments, which is the hazard vulnerability assessment. The HVA is a process for identifying the hospital's highest vulnerabilities to natural and man-made hazards and the direct and indirect effect that these hazards may have on the hospital and the community. The HVA is conducted annually to facilitate revisions to the EP program and other associated procedures.
This is the structure of the Emergency Preparedness Committee, which later on I will be discussing in detail. Emergency Preparedness Committee members starts with the Emergency Preparedness Officer or the EPO. The EPO organizes and directs operations during emergencies through the authorization of the CEO and/or the medical director. He or she suspends or reduces hospital services, announces general evacuation, and decides when to resume hospital services. The Emergency Preparedness Officer assumes the role of the Emergency Incident Commander or EIC and initiates the Hospital Incident Command System during emergencies. Our current Emergency Preparedness Officer or EPO is Dr. Bernard Cueto.
The Deputy Emergency Preparedness Officer provides support to the EPO and the entire EP committee. He acts as Emergency Incident Commander in the absence of the Emergency Preparedness Officers and carries out duties that may be assigned to him by the Emergency Preparedness Officer. Our current Deputy Emergency Preparedness Officer is Engineer Carlo de los Santos.
The Public Information Officer provides information to news media and other agencies about the incident, updates admitted patients and their relatives of status of the incident. Aside from that, the PIO establishes public information area away from the Emergency Operations Center and patient care activity and obtains progress reports from the medical officer and ensures that all news releases are coordinated with the Emergency Incident Commander and the President of the hospital. Our current Public Information Officer is Dr. Saturnino Javier. The Emergency Department Officer, or EDO, acts as an EIC when the EPO or the Deputy EPO is not in the hospital. At times when the EPO or the deputy EPO is available during an emergency, the EDO acts as the medical officer and organizes and coordinates treatment areas and treatment officers during emergency incident. The medical officer during partial evacuation prepares the ED or the emergency department for the surge of patients that are evacuated, while during total evacuation, the medical officer sets up treatment areas in the assigned relocation area. The trauma teams deploys to assist in treatment and transport of evacuated patients and personnel. The floor brigade manager organizes and coordinates emergency response in the floor level. He or she gives authorization in the order of shutting off of the oxygen gas valves in his or her jurisdiction in case of emergency. The floor brigade manager directly communicates and updates the emergency incident commander during an incident. The unit brigade manager organizes and directs emergency operations in the unit level. The unit brigade manager directly communicates and updates the floor brigade manager during an incident. The fire extinguisher detail is the personnel in charge in trying to extinguish or control fire during fire emergency. The evacuation detail safely evacuates personnel, patients, important property and records during an emergency incident. This is further divided into two, which is the personnel evacuation detail and the property and records evacuation detail. The personnel evacuation detail ensures safe and orderly evacuation of patients and other occupants of the building. He or she accounts for evacuated occupants, brings back evacuated patients, personnel and staff after the emergency, and checks and rescues any trapped occupants in the affected area. The property and records evacuation detail gathers and safekeeps important documents during evacuation. He or she functions as a property custodian of the unit and takes inventory of evacuated records and properties. He also prepares and brings medical supplies which may be needed by the evacuated patients and ensure that the return of evacuated records and properties are complete after the emergency. The manpower tracking detail mobilizes additional manpower in incident areas and assists in finding area for transfer and tracking of patients for evacuation. The Facility Service Officer coordinates overall planning and operation of all details under facility services. The Communication Detail coordinates internal and external communications and acts as a custodian of all log documented communication during an emergency. The Security Detail ensures the security of rescue operations in hazardous conditions and enforces scene facility and protection. The Fire Emergency or Safety Officer ensures fire safety within the area of responsibility in the hospital. The Utility Detail provides technical support to control fire and provide manpower support. This is further divided into different details such as the fire hose detail, the mechanical detail, the electrical detail, and the elevator detail. The fire hose detail assists in extinguishing the fire in the affected floor, and if the fire hose detail cannot extinguish the fire, contains fire until firefighters arrive to prevent spread of fire and facilitate safer access for evacuating personnel and patients. The mechanical detail shuts down gas lines in affected area to prevent rapid spread of fire. The electrical detail monitors electrical supply in affected area and other areas in the hospital and shuts down electrical supply in affected area if necessary in order to prevent rapid spread of fire. The elevator detail ensures safety in use of elevator during emergencies and assists evacuation of non-ambulatory patients to the evacuation area. The food detail provides food and clean potable water during an emergency incident. The clearing operation detail cleans affected areas after emergency response. He or she informs the floor brigade manager and the EPO through the facility service officer that the area is already clean and safe for restoration of operation and occupancy.
As you get deployed in your respective units, you will be encountering different emergency codes being announced through the hospital's paging system. It is imperative that all staff are oriented on the different emergency codes on this list. For example, whenever you hear Dr. Red, that means there is fire. And when there is earthquake, Dr. DCH is activated. When there is security in need of security assistance, you will hear Dr. Blue, Dr. Pink for infant and child abduction, and Dr. Orange for hazardous materials and spills. Whenever there are facility-related incidents, Dr. Brown is called, and for combative and psychiatric patients, Dr. Gray is activated. For other clinical emergencies, you will see this list being activated accordingly.
Key points regarding emergency codes. When activating a specific emergency code, you need to call the MMC emergency hotline, which is local 1000. Upon dialing the local number, clearly state the code to activate and the area of the event. Upon acknowledgement of the emergency hotline, the emergency code will be announced 5 times via an overhead paging system in the hospital. For example, if there is a fire in the laboratory department and upon activation of the emergency code, you will hear an overhead paging system as Dr. Red, Laboratory Department, Dr. Red, Laboratory Department, 5 times. Another thing that you need to look into is the evacuation code. If there is an E1 in the overhead paging system, that means it is a partial evacuation. And for E2, it means general or complete evacuation. During an announcement of an emergency code, always be attentive and always remember your role. During an evacuation, on when an E1 is activated during an emergency code, there are two types of evacuation. The initial evacuation, which is the horizontal evacuation, means that only a portion of one floor is affected and that patients or personnel evacuate horizontally to another section of the same building. Another evacuation is the partial evacuation or the vertical evacuation, and that it means all injured patients should proceed to the emergency department. In cases when there is an E2, it means that there is complete evacuation and that all staff, personnel, and patients should proceed to the evacuation area along the idle lane side of Urban Avenue beside Mercury Drug or the Convergys parking area. For employees that will be assigned to Ayala North Exchange, Women's Wellness will follow A&E's emergency preparedness plan and that the evacuation area is located in front of Italiani's restaurant. Here is a sketch of our evacuation routes and areas during an emergency. For all non-COVID patients and staff, the evacuation area is the idle lane side of Urban Avenue, which is the green arrow, and for all COVID-confirmed patients, the evacuation area is the Convergys parking area, which is the red arrow. We will now proceed on how to respond to different emergencies and disasters in our institution.
During fire, remember the mnemonic phrase: rescue or remove any person from the immediate scene. Activate the alarm by calling Local 1000. Contain the fire by closing the doors to the area of fire and extinguish the fire using the closest fire extinguisher. Remember the acronym PASS when trying to use the fire extinguisher. This will help you to be reminded on the steps to follow. First, you need to pull the pin, then aim the nozzle at the base of the fire, squeeze the handle, and sweep from side to side. The floor brigade manager has the authority to order closing or shutting off the oxygen zone valves in the event of a fire emergency that would potentially allow oxygen to escape into the immediate area or room, thus intensifying the fire hazard in the respective area of responsibility.
Another disaster that we may encounter, especially here in the Philippines, are earthquakes. Here are some tips that you need to observe before an earthquake. You need to check for different possible hazards in your unit. Be aware of the different safe exits. Once you get deployed in your units, make sure to look for at least two adjacent exits so that if ever one exit is obstructed, you can still go out of the building safely. Identify safe places indoor and outdoor. Educate yourself and your colleagues on how to respond to an earthquake and make sure that there is an available proper disaster supply in your unit. During an earthquake, you need to ensure to drop, cover, and hold while the shaking is ongoing. Stay away from windows and other objects that could break or fall. Stay inside until shaking stops and it is safe to go outside. The EPO will give instructions to the floor brigade managers and the unit brigade managers if there is a need to evacuate the area. After an earthquake, check for an evacuation route. Make sure that it is safe from any hazards such as ripped wirings, sparks from damaged electrical boards, leaking gases, chemical spills, and injured people or people that fell from the stairs or hit by falling objects. Always keep a safe distance away from the building and don't return to the area unless it is cleared by the emergency preparedness officer or the safety officer.
During an earthquake, Dr. DCH will be announced using the hospital's paging system. This will signal you to drop, cover, and hold. After the earthquake, all floor and unit brigade managers are advised to inspect their respective areas for any visible severe damages of structure and immediately report it to FMED and EP committee. The EP committee will collate and analyze all the reports from different departments and convene for a post-incident discussion.
Here are some key points during an earthquake and during fire. Make sure that exit routes must be marked, lighted, and free of any obstructions. Fire extinguishers must always be inspected, maintained, and employees must be trained on how to use them. Never use elevators during fire and earthquake. Know the location of at least two exit point areas in your unit, area where the oxygen shut-off valve is located, and the nearest fire extinguisher. And always be oriented on your unit's emergency preparedness plan. Another emergency that we may encounter in our hospital is power outage. Port protocol is implemented when there is power outage and electricity is not restored automatically within 15 seconds by emergency generators. Here are some of the essential provisions that we need to ensure to activate PORC protocol. We need to know which patient is on ventilator support. The unit must always at least have two flashlights in the area. Emergency lights are functional and situated at key areas in the units such as the medication room, hallways, or at the station. And to ensure that all critical life-saving medical devices are fully charged. When port protocol is activated, here is the guidelines or the steps that we need to monitor or observe to ensure that all our staff and patients are safe. Once port protocol is activated, the staff should get a flashlight and after 10 seconds, call emergency hotline to report the outage. Then afterwards, we need to check patients on ventilator and on cardiac monitor. Validate if all equipments are functional. For patients wherein the ventilator is not functional or is not working, perform manual bag valve ventilation and call Pulmolab for assistance. Prepare patients for transfer to critical care unit and call FMED to check the status and expected duration of the outage. Once we have secured the safety of our patients, reassure our patients and guests, and stay with patients on ventilator until power supply resumes or until patient is transferred to the ICU. The last topic about emergency response is how to respond to bomb threats. If ever you receive a call about a bomb threat, here is what you need to do. Try to get information from the caller regarding the following: when the bomb is expected to explode, the location of the bomb, the kind of bomb, what does it look like, and the reason for planting the bomb, and where is the caller calling from. The real reason for you to ask those questions is not to actually get those specific information, but for you to be able to prolong the conversation to take note of the caller's description. You need to take note of the caller's gender, his or her tone of voice, any background noise, and other significant characteristics that may give us a lead on the true purpose or who is really the caller. After engaging the caller, we need to inform the security department, prepare a detailed report, and if any suspicious item is found, do not attempt to move or open the object and wait for the security personnel to take over. In summary, I have discussed the members of the Emergency Preparedness Committee, the different emergency codes, and the response to different emergencies and disasters. To be efficient during emergencies and disasters, my key takeaway is to always be prepared, know your role, and never ignore your safety rules. Thank you for listening and have a great day.